Good evening, and welcome to Yodeah's men's event, Born in the USA and Jewish, featuring Max Weinberg and Ali Rogin. We are thrilled to have close to 500 participants with us this evening, viewing from around the country. I'm Rabbi Lila Haas, the Director of Adult Learning and Growth of the Center for the Advancement of Jewish Education here in Miami, Florida. I am honored to serve as a board member of Yodeah, and I join with me the members of the board and of this organization in expressing our excitement and our gratitude for you being here this evening. Yodeah's mission is a nonprofit organization and made up entirely of volunteers committed to educating the Jewish community on hereditary cancer genes and facilitating low-cost testing. Yodeah in Hebrew means to know, and that is our goal, to bring as many people into the knowledge base as possible to learn the impact of the BRCA gene and hereditary cancer mutations. As this is the week of Thanksgiving, we would like to take a moment to share our gratitude as we have an amazing group of community partners who helped make this evening possible. We want to particularly acknowledge the Greater Miami Jewish Federation and Berkowitz Pollock Brandt. Thank you all for your commitment to helping ensure a strong, vibrant, and healthy Jewish community. We have just a few quick housekeeping items to attend to before we get started. Our presentation this evening is in webinar mode, so all participants are muted. This is to ensure a quality viewing experience without disruption or background noise. For the best viewing experience, we suggest you watch the presentation in speaker mode, which you can find at the top right of your screen, as opposed to gallery view. Questions will be addressed following the presentation. You can submit questions at any time throughout the presentation by using the Q&A button at the bottom of your screen, and we will get to as many as possible. But if we aren't able to address your question this evening, not to worry. You can directly email info@yodeah.org and someone will respond to you directly. Please keep in mind, Yodeah is not here to provide medical advice. This presentation is for educational and informational purposes only, and we recommend that you should always seek the advice of your physician or other healthcare provider with questions you may have regarding a particular medical condition or treatment. So what are our goals for this evening? The goal for tonight's program is that you leave with a greater understanding of hereditary cancers in the Jewish community and what you personally can do to mitigate your risk of developing cancer, including getting tested. A primary focus of our work at Yodeah is educating the Jewish community about what is in our genes when it comes to hereditary cancers. So tonight, we chose to focus our discussion on the impact BRCA can play in the lives of the men that we love. A common misconception that we would hear frequently at our Yodeah events in the past is that people believed BRCA is a women's issue only. And they would say to us, I don't need to be tested. My mother or my grandmother never had cancer, so I can't be at risk. And then they were surprised when we had our follow-up question, has your father or grandfather been tested? So what does this all mean? Men carry the BRCA gene and can pass this gene on to their children. BRCA does not discriminate. It impacts men and women alike, making this a significant issue for our entire community. Our program tonight will begin by hearing from experts in the medical field, Dr. Liz Etkin-Kramer and Dr. Akshay Bhandari, about the medical research and developments of BRCA and hereditary cancers. Dr. Liz Etkin-Kramer is the founder of Yodeah and a board-certified gynecologist practicing on Miami Beach for more than 25 years. She is also an assistant professor of OBGYN at FIU's Herbert Wertheim College of Medicine. She has been appointed to the American College of Obstetrics and Gynecology Presidential Task Force on knowledge gaps in breast and ovarian cancer risk assessment, including genetic testing. And Dr. Akshay Bhandari is the Director of Robotic Surgery at Mount Sinai Medical Center. He's also the co-chief and assistant professor of urology at the Columbia University Division of Urology at Mount Sinai. Dr. Bhandari is one of the most experienced robotic surgeons in Florida, having performed more than 750 robotic procedures, including those for prostate cancer. And then the moment you've all joined us for. We have the incredible pleasure of hearing from father and daughter, Max Weinberg and Ali Rogin, as they will engage in a conversation about their family's personal BRCA story and the powerful impact of testing, knowing, and taking action. Max Weinberg is an American drummer and television personality, most widely known as the longtime drummer, which we were rocking out to before we started, for the Bruce Springsteen's E Street Band, and the band leader for Late Night with Conan O'Brien and The Tonight Show with Conan O'Brien. Max was inducted into the Rock and Roll Hall of Fame in 2014. Ali Rogin is the author of Beat Breast Cancer Like a Boss and is a producer with PBS NewsHour Foreign Affairs team, creating stories for television, radio, and print. Her reports have appeared on MSNBC, ABC, PBS, SiriusXM, and nationally syndicated FM radio stations. Ali is a 10-year veteran of national politics, covering the White House, Capitol Hill, and the State Department. We are grateful to have Max and Ali with us this evening and look forward to hearing their powerful story. We will conclude the evening by taking your questions. Questions can be addressed to any member of our program this evening by submitting them in the Q&A function. So now, let's begin. Join me in welcoming Dr. Liz Etkin-Kramer and Dr. Akshay Bhandari.
Thanks, Lila. Thank you. Am I good? I think I'm good. Okay. Hi, I'd like to thank everybody for tuning in tonight and joining us on this very, very exciting program. By no means do I think that anybody's joining us for us, but I'm going to give you a little context of what brought us here together. And I'm so appreciative to Max and to Ali for helping us spread this, this information. So my name is Liz Etkin-Kramer. I'm a gynecologist in South Florida. And as a physician, I have diagnosed patients with advanced cancers associated with hereditary gene mutations such as BRCA. And it is absolutely heartbreaking because these cancers could have been prevented or diagnosed at an earlier stage. And the association between BRCA and the Jewish population is very, very well established. It's been known for over 20 years, since the 1990s, when we first started to see the information coming that Ashkenazi Jewish women were more prone to BRCA-related breast cancers. Because of this, we started Yodeah to educate the Ashkenazi Jewish community about BRCA mutations and facilitate cost-effective genetic testing. The statistics are absolutely mind-blowing. 1 in 40 Ashkenazi Jews, both men and women, carry this genetic mutation. Most do not have a family history of any types of cancer, and most don't know that they carry it. So our goal, if you know you can prevent cancer or undergo screening to detect cancer at its earliest, most treatable stage, and this knowledge is absolutely life-saving. This 1 in 40 doesn't depend upon family history. And the risks of cancer the risk is markedly elevated with or without a family history. So we frequently discuss the increased risk of BRCA of cancer in BRCA carriers in the context of women, as their lifetime risk of BRCA-associated female breast and ovarian cancers is markedly high and quite preventable. But remember, BRCA mutations are carried equally by men and women, and the associated cancer risk in men, although not quite as high as women, is still significant. And these men, there are recommendations for men for additional screening to prevent an advanced stage cancer. And as I said before, this is life-saving, but first you have to know. So when we look at the risks of cancer associated with the BRCA mutation, regardless of ethnicity or regardless of where the BRCA mutation came from, if a woman carries a genetic mutation on the BRCA gene associated with cancer, they have a lifetime risk of breast cancer up to 70+%, which fortunately we have screening for, but still surgical procedures are discussed. And the lifetime risk of ovarian cancer, which as a gynecologist is quite frightening to me, can be 50%. And it's frightening because ovarian cancer we don't have screening for. And like men, women have an increased risk of pancreatic cancer up to 7%, as well as an elevated risk of melanoma. And if you look at men, and this slide really shows it well, male breast cancer can be seen up to about 8% of the time in men. Prostate cancer can be anywhere from 20 to 30% of the time. And Dr. Bhandari is going to go through this a little bit better, but it can even be higher than that. And these tend to be aggressive prostate cancers. So again, if we knew, we can do different screening. So if we know, we can formulate a management plan and for the rest of this family, the rest of the family, because once we identify someone who carries a BRCA mutation, because 50% of chance of inheriting it, a child has a 50% chance of inheriting it, we can formulate a plan to identify in my family if my family members, like my children or my siblings or my parents, carry the same genetic mutation. So this information allows us to take proactive steps to decrease the risk of an advanced cancer. And for men, this includes monthly self-breast exams and clinical breast exams yearly with a provider, such as a breast surgeon, beginning as early as age 35, and to even consider mammograms according to the most recent guidelines. To prevent an advanced prostate cancer, screening for BRCA2 carriers is important, and carriers for BRCA1, it's considered, and Dr. Bhandari will discuss that a little bit more in a few minutes. Excitingly, there is now new data for pancreatic cancer, and National Comprehensive Cancer Network just changed their recommendations. If a BRCA2 mutation positive carrier who has a family history of pancreatic cancer, there is screening available for pancreatic cancer, which is brand new. The data just showed that it can be life-saving by doing yearly pancreatic MRIs or endoscopic ultrasounds. And the data shows that can pick up pancreatic cancer at an early enough stage, 90% of the time, where surgical treatments are available, which is unheard of. And in fact, the studies have shown the 3-year survival is over 80% in BRCA carriers who carry pancreatic cancer, who have been screened appropriately. Finally, because of the increased risk of melanoma, evaluations of the skin and even in the eyes is very important, because the eyes can develop melanoma. So again, if we knew, we can take these proactive steps. But if you think about it as well, as we talked about before, we also know that with a family, we can consider, and if you can, thank you, we can consider in vitro fertilization, which is a way of taking an embryo that's been fertilized and checking it for a BRCA mutation. And when it gets implanted into a woman, the doctor can screen out BRCA mutation, so the implanted embryo doesn't have this genetic mutation. So we don't have this issue in future generations with this increased risk of cancer. What's pretty cool in our area in South Florida is that Greater Miami Jewish Federation actually has interest-free loans available to people to help them undergo this journey if they choose to. So as I said, this is empowering. And we're going to hear now a little bit more from Dr. Bhandari about what we can do specifically in terms of the risk of prostate cancer. Thank you.
Thank you, Dr. Kramer, and thank you everyone at Yodeah for giving me this wonderful opportunity to come and speak with you today. Thank you for attending tonight's lecture. So today I'm going to talk about hereditary prostate cancer. And for those who do not know, November, also called Movember, is Men's Health Awareness Month, which includes making men aware of risks of various men-related cancers, including prostate cancer. So we'll be focusing on the hereditary aspect of it, as you've heard from Dr. Kramer. Next slide, please. So besides skin cancer, prostate cancer is the most common cancer in men. It accounts for 20% of new cancer diagnoses in men. This year alone, about 200,000 men will be diagnosed with prostate cancer, and upwards of 33,000 men will die of prostate cancer, which means 1 in 41 men will die of prostate cancer. That being said, given our aggressive screening and significant improvement in treatment technology and treatments available for prostate cancer, there has been a significant reduction in death from prostate cancer over the past 20 years. So there are different types or causes of prostate cancer. The most common is sporadic, which just occurs by chance, where there is typically no family history of prostate cancer. And then there's the hereditary prostate cancer, which is what we'll be focusing on today, where a gene mutation is passed down from a parent to a child. Germline testing is a genetic test conducted on blood or saliva to determine if a patient's cancer is hereditary. Both men and women can inherit and pass down mutations, and men with family history of breast, ovarian, and prostate cancer and Ashkenazi Jewish ancestry should consider germline testing, like Dr. Kramer had suggested. Up to 17% of all prostate cancers are hereditary, and they can be inherited from either the maternal side or the paternal side of the family. And they may develop more than one kind of cancer, and typically many of these cancers are more aggressive and can occur at a very early age. So if you look at this slide, as Dr. Kramer had said, that up to age 70, actually, there is a almost 20 to 30% likelihood of developing prostate cancer if you were to carry a BRCA mutation. However, if you look at men up to age 85, that risk goes up to as high as 60%, which is significant. So there are a few instances where we recommend aggressive screening for hereditary prostate cancer. If you have someone in your family who had metastatic prostate cancer at any age, or anyone who has a history of prostate cancer and has relatives with breast, ovarian, pancreas, and prostate cancer, or a history of male breast cancer at any age and Ashkenazi Jewish ancestry. So as we've heard, majority of the hereditary prostate cancers are caused as a result of mutation of the BRCA genes. What we do know is that the BRCA2 mutation has a very strong association with prostate cancer. And the relative risk goes up almost 2 to 6-fold if you were to have a BRCA mutation. In fact, some studies show that in younger men, this risk is even higher and goes up 6 to 9-fold. And we also know that BRCA mutation carriers present more often with aggressive disease and at a younger age. As our knowledge has improved, the National Comprehensive Cancer Network guidelines has also incorporated germline testing into certain high-risk populations, as you can see. So what are the screening tools? What do you do if you have this risk of developing prostate cancer? Obviously, the first thing is routine physical exams and annual visits with the urologist, or more often as needed, depending on symptoms or baseline tests. There are a number of blood tests that are used for screening of prostate cancer that help us figure out who should be screened and how aggressively. And there's been significant improvement in imaging, which helps us also figure out who should receive a prostate biopsy. And eventually, obviously, if the risk is very high, then the recommendation is to have a prostate biopsy, which is a 5 to 10 minute procedure in the office under just a local block without any general anesthesia. So why do we want to diagnose hereditary prostate cancer? Well, as discussed, if we diagnose it early and offer prompt treatment, we can have much better functional outcomes with regards to incontinence and impotence as a result of these treatments. We do know that these cancers tend to be more aggressive. And a lot of you may have heard about something called active surveillance in the setting of early prostate cancer, where in a lot of patients, we tend to observe those cancers and not treat them. However, if we were to diagnose you with hereditary prostate cancer and have BRCA mutation, we typically tend to be more aggressive treating them, and an early intervention is recommended. And obviously, this knowledge helps us counsel patients genetically. And also, there are certain cancers that are associated with these mutations, and aggressive screening can be offered for these cancers. So in summary, hereditary prostate cancer is undiagnosed and is underdiagnosed in the community, and men with a strong family history and Ashkenazi Jewish ancestry should be aggressively screened and screened early. With early diagnosis and prompt treatment, prostate cancer has excellent survival with a very good quality of life, including preserving incontinence as well as sexual function. Thank you very much.
So I just want to put a little bit more information out there. Akshay, thank you. You can see now how important it is to get screened early. Usually we say about age 25 to know if you carry this genetic mutation. And this is where Yodeah comes in. Remember before I already said that we would help you, we facilitate testing. That's what we do too. And there are various ways you can get tested, and on our website, we have all this information. Now, some people prefer to go to their doctor and get tested, although a lot of doctors don't feel comfortable doing genetic testing the way I would do in my office. Some people choose to see genetic counselors, which is fine as well. But you can simply go onto our website and order a test from us. We have a link to a medical grade lab. It's one of the labs I use in my office to test patients. And they mail you a kit. It looks like this, and you collect a saliva specimen. It's only about this much. It looks scarier than it is. And you just don't eat for about 30 minutes prior to it. So I always thought it would be a good idea to test during Yom Kippur, because it's much easier to do that way. You mail it in, you get your results in 3 weeks. And with the results, you also get genetic counseling by the lab. That's also included. Don't forget to put code KNOW30, KNOW30. It's all on the website. Because you'll get a discounted rate through the lab, who is kind enough to give us a discounted rate. Remember, we are lab agnostic. We believe in medical grade testing. We believe this information is life-saving, and we want to empower all of you to do this, but we have no commercial association with any lab, and we don't receive any remuneration whatsoever. We just want to make sure that you're aware, and you can prevent an advanced cancer. Thank you.
Thank you so much, both of our amazing doctors, and we appreciate so much the information that you shared with us this evening. Rabbi Lord Jonathan Sacks, who is the chief rabbi of the United Kingdom, once said, "The Jewish people are a nation of storytellers. Our tradition teaches us the importance of passing down lessons, and personal history, l'ador vador, from generation to generation, so that the next generation may be empowered and strengthened by the knowledge of who they are and from where they come. We are honored tonight to welcome Max and Ali, who will demonstrate this Jewish value of sharing one's personal story and the impact it can have on future generations. Welcome, Max and Ali.
Well, it's good to be with you all. Rabbi, thank you very much. Ali, wonderful to see you. We're socially distancing this Thanksgiving, so it's a pleasure for me to see your pretty face, your beautiful face, and your fantastic book over your right shoulder, which I have found, and I must say in an unprejudiced way, tremendously informative. And the narrative you weave is quite incredible. And needless to say, your mom and I are incredibly proud of you for having accomplished such a formidable task, as writing a book about a subject that you not only know so much about, but you've experienced personally yourself, as we have in our family. So I'm glad to join the physicians among us and the participants out in the ether to discuss this incredibly important subject, and one that, without exaggeration, saved my life.
Absolutely. It looks like Dad's screen has frozen up momentarily, but there we go. I think you're back with us. So we lost you when you were talking about all of this testing saving your life, Dad.
Well, I can say that, and Ali, you know this story, but for everyone tuning in tonight, my story began where I've been a professional musician since the age of 7, and I didn't have a stage mother in terms of getting me on stage. What I had was a mother, my mother Ruth, who lived to the age of 98, and her perspective on having the only son in our family was every 6 months, without fail, my entire life, I went to a plethora of doctors. I had a doctor for everything, and this was a priority in my family. So I got quite used to it. So I consider myself very fortunate to have been the recipient of this kind of attention, because at an early age, it was literally drummed into me to be proactive and assertive with my healthcare, which I did. I'll be 70 my next birthday, and I'm very, very thankful that was a priority in my family. Just to give you a short history, when I was 35, I was diagnosed with a particular type of heart disease, which presented itself at the time as wasn't that big a problem at that time, but it was a situation of waiting and watching. I started having PSA tests when I was 30, and always tested a little bit on the higher range, always below 4, but variably. So as a tie-in to my watchful waiting on my heart situation, which I did have fixed when I was 59, I had an incredibly thorough general practitioner who virtually tested me a PSA test every 6 to 8 months for many, many, many years. And it always hovered that number around 3, 3.2, it would drop down to 2.8. And as I believe most men, I hope most men are aware that the PSA test is a reasonably good indicator of your propensity. All of this came into focus when my oldest sister, at the age of 54, very suddenly and out of the blue, being in the medical profession herself, developed ovarian cancer. And tragically for our family, my sister, Pat, died of ovarian cancer when she was 57 in the year 2000. And during that last few months in conversations with my sister, she had, almost in an offhand fashion, told me that she had been tested for this gene, this Ashkenazi Jewish gene, and she tested positive. And I must admit, at the time, I didn't know anything about that. It was a very sort of foreign concept to me, but she advised me shortly before she passed to get tested myself. And I took it very seriously. So I did. About a year later, I said, well, I really should check this out. I'm in a window of age where these things start to present themselves. So I went to the NYU Genetic Testing Center. Allie, you remember because you were a student at NYU, and I had the test and it came back positive for the BRCA2 gene. Now, jumping ahead, when my mother passed on at the age of 98, she was tested, she didn't have it. So I am assuming that I got it from my father. And my father died of colon cancer. So this was a shock to me. But what it meant was extra vigilance on my part, because the BRCA gene can show up anywhere. So I am extremely fortunate that I have access to excellent healthcare and physicians who specialize in these various areas. So I was subject to full body MRIs early on. And I said, well, now that I know this, I'm going to do everything I can to use that information I can't prevent what's going to happen to me, but I can certainly track it, be aware of it, and inform my children that this is something that they need to be aware of. And I must say, in retrospect, now that my children are fully adults and grown up, I was definitely a helicopter father in terms of checking out everything and being extremely paranoid about my children's health and safety. And you can't be too involved with that. So, my story was that every 6 months from the age of 35, I had a DRE. And again, the PSA, was always in the mid and high 3s. And then one day, my general practitioner, who happened to be a cardiologist, said, gee, I think you ought to see this pal of mine in the town we lived in, who's a very good diagnostician. He's a urologist. I just think something may be going on. So I did. And this was when I was 59 I forget what year that was. What was that, 2010? And I did go to him, and over a series of 3 months, it was pretty interesting. And I'm someone who's not turned off at all by healthcare, by surgery, by any kind of medical procedure. When I was a kid, I had a physician's desk reference that I would read because I was convinced I had almost everything in it. So to say I was paranoid about my health, I may have been paranoid then, but I was just a very vigilant individual. And so I know we have a limited amount of time tonight. I will jump to where my urologist said, you know, this could be an infection. You have, what happened was my PSA went from 3.2 to 5.4 in 3 months. And that was really concerning. And I found out something I did not know, that it's not necessarily the number, that anything below 4, you're fine, you're safe. It's the velocity of change. And I went, as I say, from low, you know, mid 3s to over 5 very quickly. So something was going on. We thought it could also be from, do you ride a bicycle? Well, no, I don't ride a bicycle. Well, what do you do in your life that could maybe put pressure on your groin area? And I said, well, I spend most of my day on a drum seat. So he said, well, you know, bring your drum throne, they call it, into the office. I'd like to see how you sit on it. So I sat on it, and he said, you know, we should do some investigation over the next 3 months. And over the next 3 months we did, and it turned out to not be an infection or an inflammation. He said, I think we should do a biopsy. Now, men are absolutely terrified of the word biopsy in that region. And I'm here to say that, guys, it's no big deal. It was one of the least invasive procedures I've ever had, and I've had some. And I believe personally that a prostate biopsy should be the new norm because of the advances in the actual technique. You know, they typically take 12 samples, and then he had done that, and it was completely painless. There was no repercussions. It was no strain, no big deal. But I said, well, look, you're taking these samples, you might as well keep going. He said, well, if I keep going, I'll get the whole prostate out. You don't have to worry about anything. He was joking. But they did the exam, and I'm glad I did, because it came back that I had suddenly developed in 2 quadrants. There's 4 quadrants that they divided into, the upper right and the lower left. I had developed 2, as they described it, garbanzo-sized tumors. And this happened very, very quickly. And this happened to someone who was extremely diligent about staying informed about every part of my body. And I had no symptoms. I had no prostatitis. So I asked the doctor, okay, what are the protocols for this? And he described them, and I wasn't particularly a candidate for anything that wasn't aggressive. And I said to him, and this is an important question, I said, well, if you were me, would you operate on me? And he goes, you know, I'm a very good diagnostician. I think one of the best around. But if you're asking me a question as pointed like that, no, I would not operate on myself with my level of skill. I said, well, who would you go to? And he said, well, personally, I would go to the leader in the field who was the head of surgery at Sloan Kettering. His name was Peter Scardino, who has since ceased his practice, but he's still the head of surgery at Sloan Kettering. And he literally, my urologist told me, wrote the book on prostate cancer. And he did, Peter Scardino. So I got the book. And I called up and I made an appointment, and I was fortunate to be able to get in to see him after having read the book. And Dr. Scardino gave me again the options, and he said, well, I said to him, well, what would you do? And he said, well, if it was me, you know, I'm a surgeon, I would get it out. I said, well, let me ask you, Doc, did I catch this early? He said, well, not terribly. And that completely shocked me, because this happened in the long-term history of my life. This happened overnight. So it's not a question of this is something that's going for years and years and years. I was fine. And 3 months later, I had 2 not insignificant tumors. So I chose surgery. And I was glad I did, because I said, if there's a protocol that can enable me to deal with this once and for all, I believe in treating aggressively. The idea of watchful waiting, well, to me, that would have been nerve-wracking. I'm not saying that it's not appropriate for individuals who desire it. For me, it's like a snare drum shot. I'm going to hit that snare drum shot, and I'm going to make sure you in the audience can feel that snare drum shot. So this was my snare drum shot of a chance to just, really beat it. And then I found out a lot about the Gleason scores and where I stood on that. There's a tremendous amount of literature for men and women to read about these things that could potentially affect them. Not the least of which, Allie, I must say, is the book, Beat Breast Cancer Like a Boss, which I'm, what can I say? I'm delighted you wrote it. But when I did get, just to finish up, when I did get diagnosed with the BRCA gene, I suggested to you that you get it. We didn't know that I developed it from my father, but you, again, took my example of proactivity and ran with it. And with that, I will turn it over to you.
Thanks, Dad. And yeah, that's exactly what you did. And I know that you said in your presentation that you were a helicopter father and hovering over me and my brother Jay as we made our way medically and in all other ways through the world. But I have to say that I think you're selling yourself short, because the greatest act of love I think you could have provided to me in addressing my genetic fate was the restraint that you showed. You and Mom waited, I think, 8 years between when you tested positive for the BRCA mutation and when you told me that I might be a carrier, because you did not believe at the time, and you waited until I was 19. You waited until you believed that I could handle that news myself, and that I could make sound decisions about my future. And it wouldn't have done any good to tell me any earlier. And I really do appreciate that, because we've talked about this before, but I can't imagine how excruciating it was to hold on to this knowledge and know that it wasn't really the right time to tell me about it. But when you did, I was a junior at NYU, as you mentioned, and I immediately, when you told me that you had tested positive for this mutation, I said, well, I have to at least know if I'm positive or not so that I can make decisions accordingly. So I went, luckily at NYU, they were on the cutting edge of testing. So I had the BRCA analysis. A few weeks later, I sat down with the genetic counselor who told me I was positive. I'm BRCA1. I know, Dad, you said you were BRCA2, so I'm not sure about that, because I definitely have BRCA1, but I'm just putting on my journalist hat and doing some real-time fact checking here. But anyway,
you have to bear with me because I am a drummer.
Yes, exactly. The genetic counselor went through a few of the options with me about my choices for preventative action and early surveillance, but I thought that, to my detriment, she really focused on the surveillance aspect. She said I could start getting MRIs and mammograms, alternating them every 6 months, so that we could catch whatever happened fast. She didn't even mention prophylactic surgery for my breasts. She did focus on when I should remove my ovaries, and that I should consider having children earlier in life than I might otherwise have. I was a 19-year-old college kid, so that wasn't very germane advice to me at that time. So I left her office feeling really distressed, thinking that I had no choice but to sit and wait for cancer to catch up with me. I then sought a few other opinions and learned that more and more women my age were pursuing prophylactic bilateral mastectomies. And that's exactly what I did. I think I waited a little while before I ended up doing it, but I believe I was 20. I was in my senior year, just about to graduate. A few months before graduation, I had my mastectomy, and then a few months later, I had my reconstructive surgery, and I never looked back. A few years later, Angelina Jolie came out with her story about the BRCA gene and about her decision to have preventative surgery. And I felt a great sense of solidarity in hearing her story. And that's really what inspired me to write this book. which features interviews with 30 incredible women, including some bona fide celebrities that we've heard about: Edie Falco, Sheryl Crow, some incredible lawmakers, including Debbie Wasserman Schultz, a congresswoman who is also BRCA positive, wonderful journalists, my colleagues, including CNN's Athena Jones. And it's just my attempt at providing another layer of that community that I think all of us seek whenever we're going through a trial, whether it's a disease, cancer, or of course, the COVID-19 pandemic that we're all experiencing. So this is definitely something in terms of the genes. I think I mostly inherited good genes from my dad, including a good musical ear, great Weinberg hair, but unfortunately there are some that are faulty. However, it's a blessing that we have the sorts of technology that we can harness to help tell our genetic future, and of course, help tell the genetic future of generations to come. So thank you all for spending your evening with us, and I will hand it back to the rabbi.
Thank you both so much. And thank you so much for inviting us into your family story and for such a profound impact and inspiring us with your words. I want to remind everyone to go online and purchase Allie's book, Beat Breast Cancer Like a Boss, and download Bruce Springsteen's latest album, Letter to You. Both are well worth your time and to enjoy them equally. However you're celebrating Thanksgiving this year, whether it's virtually or socially distant groups, we encourage you to bring this important conversation to your physical or virtual tables. Ask about your family history. Ask anyone in your family if they've been tested for the BRCA mutation. Share the information that you've learned tonight and take action as a family to get tested. You will be grateful that you did. This weekend, we will read from the Torah Parshat Vayetze. It is the story of our patriarch Jacob and his incredible dream of a ladder where angels were ascending and descending from heaven and earth. When Jacob arises from this slumber, from this dream, he says an incredible line. He says, God was in this place and I didn't know it. That coming into a space of knowing forever changes the trajectory of his life and changes him personally. For me, 6.5 years ago, I came to a place of knowing. I had known that cancer was in my family. I knew that my mother, thank God, is a breast cancer survivor, my aunt, a breast and ovarian survivor. But as I was serving a pulpit as rabbi, it was a particularly challenging year as I buried 3 young mothers to cancer. It was at that moment that I decided to confront my own family history. I decided to get tested for the BRCA mutation, and I found out that I was positive. I'll never forget that moment when I opened the envelope and it said that I had an 87% chance of developing breast cancer in my lifetime and a 50% chance of ovarian cancer. What was even more striking for me at the time was that I inherited the gene from my father, like Allie and like so many others. That moment of coming into knowing after I was tested changed forever the trajectory of my life. For it was in that moment that I felt empowered and strengthened with the knowledge that I could take control and potentially save my life and mitigate my risk of developing cancer. I had a double mastectomy for my 30th birthday, and it was the greatest gift I've ever given to myself. Last year, my sister, for her 30th birthday, after she tested positive with the BRCA mutation after attending a Yodeah event, she took the spit test and submitted it and found out she was positive, had her mastectomy, and also considers it the greatest birthday gift she's ever given to herself. Last year, my husband and I began the journey of beginning a family. And for many reasons, we had to go down the IVF path, in vitro fertilization. But what was so empowering in that journey was that we had the ability to screen the embryos with genetic testing so that we had the ability to know if we were going to pass on this gene to the future generation of our family. There is nothing more amazing than getting a phone call from your doctor saying, Lila, I know that we harvested 9 embryos. 7 of those 9 embryos carry the BRCA mutation. 8 of those are not viable. You have 1 perfect embryo. It was in that moment that we said to our doctor, we feel incredibly blessed. This will be our child. And thank God, our little sweet Asher celebrated his 2-month birthday just days ago. So this Thanksgiving, we are incredibly grateful and blessed to know that our son does not carry the BRCA mutation, and that I have the ability to continue to be a strong mommy for him and to be here with him as he grows big and strong. There is power in knowing. There is power in entering into a space where you can know and take action and make empowered decisions for your own life. I ask you tonight to go to yodeah.org, to click on the button to order a test. And I promise you, knowing and taking testing and taking action will be the greatest gift that you can give yourself. God is in this place, and I truly know it, because I came to a place of knowing to take action and to be able to ensure for myself a long, happy, healthy, please God, cancer-free life. And so can you. So what can you do? What does it mean to take action? Get tested. Get tested for yourself, for your children, for your grandchildren. It's an easy saliva test. You'll go to yodeah.org, you'll order your test tonight, and you'll be sure to include the code KNOW30 when checking out, and you'll receive Yodeah's discounted rate of $149. While you're there, buy a kit for someone you love. Give them the gift of life and knowledge. Hanukkah's around the corner, Christmas is around the corner. This is a festival and season time of giving and being grateful. Do this for someone that you love. There are a few additional points I'd like to make regarding testing. The lab runs medical grade multi-gene panel, which includes mutations on the BRCA genes and 28 other genes that can increase your risk for hereditary cancers, including breast, ovarian, pancreatic, prostate, and colon cancer. Whether you choose to be tested through the lab link on our website or through a healthcare provider or a genetic counselor, wherever you decide to go, the most important thing is to get tested. We are lab agnostic and have no financial tie to any lab. We just want you to get tested. You can find out all of this information and more on our website, yodeah.org. Educate others about the risk of Jewish hereditary cancers. As I mentioned before, share this information at your tables in just a few days and encourage others to get tested. Discuss it with your spouse, your partner, family members, and friends, men and women, so that they can find out before they develop cancer. We can treat the BRCA mutation like we did Tay-Sachs and educate the Jewish community to take action. If you're interested in organizing a Yodeah event like this one in your community, contact us and we'll be happy to plan a virtual event for your community. And one day, if we're ever to go back in in-person events, we'll be happy to do that. Our mission is to educate and provide low-cost testing. And also tonight, I want to ask you to consider contributing to help us continue to educate and test more people in the Jewish community. You can make a donation to Yodeah by going to our website, and your gift will help us with our mission to educate and provide low-cost effective testing for all Ashkenazi Jews. We're a small organization with a very big goal: saving lives. Please help us turn that goal into a reality by making a tax-deductible gift to Yodeah via our website. Our tradition teaches, he who saves a life, it's as if he has saved the entire world. Join us in helping to save the lives of those whom we love and in so doing, helping to ensure a vibrant, strong Jewish presence for many, 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 many years to come. So it's 8 o'clock, and we'll continue for a few more minutes and answer your questions. And then following the questions, we'll hear a few more stories from Max and Allie. So we hope that you will stay with us. For those who need to leave us now, we're so grateful that you joined us this evening. We hope that you found it worthwhile. When you leave, make sure to go to yodeah.org and make sure to get tested and spread the word. So we'll begin now with a few questions. I would like to invite our panelists back to join us, as any of your questions can be addressed to any of our panelists. So we have our first question. Our first question is for Dr. Bhandari. Dr. Bhandari, at what age should this participant begin screening for prostate cancer? And is this done by their regular physician, or do they need to see a urologist?
So per the guidelines, even with BRCA positive men, the likelihood is that around 45 is when there's a higher risk of developing prostate cancer. So most guidelines suggest between age 40 and 45. I mean, it's okay to get a baseline PSA at 40 and see if it's really low. And then based on that, one can take it from there. It's okay to do it with your primary doctor, but I would suggest that if you do have, if you have tested positive for a gene, it's always better to see a urologist, because as Max said, sometimes it's not just the number on the PSA, it's how quickly the PSA rose. And those are little things that the urologist would probably be a little bit more, ready to pick up than a general physician.
Thank you. Dr. Etkin-Kramer, what impact does genetic testing and a positive genetic mutation have on my insurance, health insurance, disability, long-term, and life insurance?
So that's a common question, and it's obviously a really big concern. In 2007, there was a law that was enacted, a federal law that said that it is illegal to discriminate against anybody for the genetic results. So from a health standpoint, from a health insurance standpoint, but that does not include life insurance or disability insurance. So often my patients will get that in place and then get tested. The other really interesting thing is, and this is a different lens in a way to look at it, is if you have, because it's very rare to get a new mutation. There are other genes that you have new mutations in. This is not one of them. So if you have a mom and dad that are negative, so it's very unlikely that their children will be positive. There are case reports, but it's very unlikely. So if a young 30-year-old doesn't have their life insurance in place, if both parents are negative, I can feel more comfortable that they're not going to carry a genetic mutation. So.
And Dr. Kramer, another question that we just received is, if I'm BRCA positive, BRCA positive, or have prostate cancer, am I automatically passing this on to my children?
No, thank God. There is but it's still fairly high. It's a 50-50 chance. So that's the importance of knowing. We wouldn't normally recommend testing until somebody's emotionally able to deal with it. It's a hard thing, as Allie and Max shared. It's not an easy thing to think about. Ideally, I'd love my patients who are eligible for testing because they're Ashkenazi Jewish, men and women, by around 25 to 30, so we can make healthy management choices for them. But there's a 50% chance, because it's autosomal dominant, that your children will inherit the mutation. And it doesn't mean that you're definitely going to develop cancer. It does not. It just means you have to be followed a little bit closer than the general population. It gives us a little bit of something that we can manage and control. There are so many things in this world we can't control what we can.
Right. Thank you so much. Due to time this evening, we don't have time to get to more of your questions, but we want to encourage you to please feel free to email us at info@yodeah.org, info@yodeah.org, and we will respond directly to each of your questions. Go to the website for more information on hereditary cancers, testing or to make a donation to support this important work. There was a wonderful comment that just came through that I just wanted to share with Max and Allie. It says, Allie, I love your book. It's inspiring and I've recommended it to so many. And Max, thanks for the music. It got me through my cancer journey. Max and Allie, I wanted to offer to you, if you had any final thoughts that you wanted to share before we signed off this evening, to please come back onto camera.
Deb, why don't you start us off?
Yeah, go Allie.
No, you go ahead. You go ahead.
Well, I would just add that the idea and the concept of knowing, if you educate yourself, you'll be armed for whatever potential dangers you might face in your life. And health is, without that, you have nothing. And so I believe, as you say, the concept of Yodeah is extremely important for every individual to address and to pay attention to. Allie?
And I would say thank you for picking up the book. That's very kind, and I'm really glad that you have found some things in it that resonate with you, and hopefully those who else you have recommended the book to have also. I think one other anecdote that I think is something that probably a lot of people have to deal with who have had cancer in their family, and it's something I write a lot about in the book, is how loved ones, how family members can support the person going through cancer, because not everybody wants to hear the same things. Not everybody wants to be treated in the same way. Every cancer journey is, of course, different. And I write a lot about how, one of the worst things you can do is when a loved one tells you their diagnosis, is for you to start freaking out, because then that person is not only having to grapple with their own emotions about the cancer, but they're having to deal with the baggage of addressing your feelings about their cancer. So that can be really burdensome. And I think that's something that almost everybody in the book says: if you have somebody in your life who is dealing with with any cancer, listen, be supportive. Don't rely on platitudes like you'll get through this, because there's no guarantee in life, but you can choose to have an outlook that puts faith and trust into your medical providers and into your team that will be working with you, and also just to listen to the patient. But even though I wrote a book about that, part of why I wanted to focus on that dynamic was because when my dad told me that he had prostate cancer, which was actually just a few years after not even a few years, I think it was like a year. I hadn't moved to DC, so it was still in that post-college phase. I started crying hysterically. And I think I had incorporated a lot of my own baggage about my experience with the BRCA mutation, and that I knew how difficult those surgeries had been, although in retrospect, they weren't actually that difficult. But I had sort of the shell-shockedness of going through that, and that I think I transferred onto my dad. He's always been incredibly gracious, and when we talk about this, by saying that, he understands that I was just being honest with my emotions. But I have many times laughed at how I basically did exactly the wrong thing to do. And it's, I think, an illustrative anecdote to demonstrate the importance of when you're talking to somebody who has breast cancer, don't shy away from the conversation, because they want to talk about it, but they probably don't want to hear about how worried you are or about your relative who also went through this cancer. So Dad, I know you and I have talked about this before in contexts like these, but it is something that, I feel very strongly about.
Well, I appreciate that, Allie. And I guess the response that I had at that time was, it was honest, it was true. And because I had educated myself, this is one of the most important thing I found, not just in this particular subject, but almost everything. When you get the information, when whatever it is, on both sides of a question, or the myriad answers you can get to questions, the more you delve into discovering for yourself what it's about, it starts to unfold, it starts to open up. It's like an album of music. The more you listen to it, the deeper it becomes. So I want to also thank the viewer for the sentiments regarding the music that we've made. And if it did help anyone through a tough time, or just enabled them to dance across their problems for an hour or two, as Bruce would often say, I'm pleased to have been a part of that. But knowledge is power. And the more you learn about something, believe it or not, the calmer you will become, because you examine it from an intrinsic point of view rather than the externality of it's very, to be diagnosed is very emotional. But if you have the ability to fall back on science and the incredible advances that are being made every day in this field and other medical fields, I think it gives you a better chance of having a logical, more rational, less emotional response.
Absolutely.
Thank you both again so much for everything that you've done this evening. Thank you to Dr. Liz Etkin-Kramer and Dr. Bhandari for sharing your wisdom and your insight, and for helping to bring us all to a space of knowing and knowledge that we might be empowered to make the decisions that can help ensure a long, healthy life. We want to thank you again for spending part of your evening with us. Go online tonight, order your test, make an appointment with your healthcare providers or genetic counselors, and get tested. Do it for yourself, do it for your children, do it for your grandchildren, Lador Vador for the next generation. We want to thank our partners, all of our community partners. And again, we want to thank the Greater Miami Jewish Federation and Berkowitz Pollock Brandt for their amazing support in helping to provide the technical assistance for making this night virtually possible. We thank you all for being with us. We wish you a happy Thanksgiving. May it be a Thanksgiving of gratitude, of blessing, and may we all look forward to sharing the stories around our table and sharing this important story, that we all might know, be empowered, get tested, and have the ability to live a long and healthy life. Thank you so much for being with us.